Good afternoon, ma'am. Good afternoon, classmates. I am Charmaine Salazar Moico, and my topic for today is about exercise behavior and adherence, which is the chapter 18. Trans-theoretical model. Although the models just discussed are useful as we try to grasp why people do or do not exercise, this construct tends to focus on a given moment in time. However, the trans-theoretical model argues that individual progress through stage of change and that movement across the stage is cyclic rather than linear because many people do not succeed in their efforts at establishing and maintaining lifestyle changes. So when we say trans-theoretical model, it is the change of health behavior involved progress. So there are 6 stages of trans-theoretical model. First is the pre-contemplation stage. Second is the contemplation stage, preparation stage, action stage, maintenance stage, and termination stage. The pre-contemplation stage. At this stage, individuals are not yet thinking about changing their behavior and may be unaware of the need for change. The contemplation stage. Individuals are start changing their behavior but still undecided or unsure. Third one is the preparation stage. Individuals are getting ready to make a change step by step. And fourth is the action stage. This stage involves actively changing the behavior. Number 5 is the maintenance stage. After successfully taking the change, individuals work to maintain their new behavior and prevent relapse into old habits. So the last one is the termination stage. At this stage, the new behavior becomes ingrained and individuals no longer feel tempted to revert their old habits. Okay, next. The physical activity maintenance model. The ecological model. One class of models that has recently gained support in the study of exercise behavior is the ecological model. So when we say ecological model, it focuses on changing behaviors while accounting for the influences of social, physical, and political environment. The term ecological refers to the models, frameworks, or perspectives rather than a specific set of variables. So for example, the EIA or Environmental Impact Assessment. So, ang environmental impact assessment, before constructing new sports facilities, an ecological model can be employed to assess the environmental impact. So, this includes evaluating factors such as habitat, disruption, water usage, and waste generation, aiming to minimize negative effects on ecosystem. The integration of models. Zhang and Solomon in year 2013 described the possibility of combining the ecological model with SDT to promote exercise behavior. Especially, the basic principle of the social ecological model is that each behavior setting that environmental characteristics that are relevant to specific types and purposes of physical activity. So, ang integration of models, it involves combining different models or methodologies to create more comprehensive understanding or a solution to a problem. So next is the determinants of exercise adherence. Theories helps us understand the process of adapting and later maintaining exercise habits and gives us a way to study this process. Another way researchers has attempt to study adherence to exercise program is through investigating and specific determinants of exercise behavior. In a broad sense, the determinants fall into 2 categories: the personal factors and environmental factors. So when we say personal factors, refers to an individual characteristics such as beliefs, attitudes, values, and personality traits which influence behavior and decision making. While environmental factors, on the other hand, encompass external influences such as culture, social norms, economic conditions, and physical surroundings that shape an individual's experiences and choices. In essence, personal factors are internal while environmental factors are external. So there are 3 kinds of personal factors. First, the demographic variables, cognitive and personality variables, and last is the behavior. The demographic variables is a variable that is collected by our researchers. For example, a variable such as age, gender, ethnicity, socioeconomic measures, and group membership. The cognitive and personality variables refers to aspects of mental processes like memory, attention, and problem solving. Personality variables, on the other hand, involve characteristics such as extroversion, openness, and consciousness that shape an individual behavior and attitudes. And the last one is our behavior. The environmental factors. So, meron man siya 3 kinds of environmental factors. First is the social environment. Social environment encompasses interactions, relationships, and cultural influences among people. Second one is the physical environment. Physical environment refers to the natural and built surroundings where life occurs. So, last is the physical activity characteristics. Physical activity characteristics encompass aspects such as intensity, duration, frequency, and type of the activity. These factors determine the effectiveness of exercise, influencing factors like cardiovascular health, muscle strength, and weight management. So, leader qualities. A good leader can compensate to some extent for other program deficiencies, such as a lack of space or equipment. This underscores the importance of evaluating not only a program's activities and facilities, but also the expertise and personality of a program leaders. Good leaders are knowledgeable and likable and show concern for safety and physiological comfort. So to become a good leader, you must focus on communication, empathy, and continuous learning. Listen to your team, understand their needs, make informed decisions, and always strive to improve yourself and leadership skills. So, adherence to mental training programs. Integrate physiological skills into existing routines and practice. Reinforce athletes' feelings of enjoyment gained from using mental training strategies. Third, show the relationship between mental training and achievement of personal goals. Individualize mental training programs as much as possible. And then last is promote mental training as much as possible because before the individual starts to work on specific mental training exercises. So, amo to siya ang mga adherence of mental training programs. So, there are 10 physical activity in school and community programs. First is policy. Second, community programs, environment, physical education, health education, extracurricular activities, parental involvement, personnel training, health services, and last is evaluation. Strategies for enhancing adherence to exercise. Behavior modification approaches. Behavior modification approaches is the planned systematic application of learning principles to the modification of behavior. Behavior modification approaches may have an effect on something in the physical environment that acts as a cue for habits of behavior. So one example of behavior modification approaches related to physical activity or sports is the use of positive reinforcement. This involves rewarding desired behavior such as consistently attending sports practice or completing the daily workout with incentives like praise, recognition, or tangible rewards. Reinforcement approaches. Reinforcement, either positive or negative, is a powerful determinant of future action. To increase exercise adherence, incentives or rewards can be given for staying with the programs. So, the difference between positive and negative approach is a positive reinforcement, praising for rewarding desired behaviors like praising a player for executing a skill correctly or rewarding a team for a good performance with extra practice time. So, negative reinforcement, removing a negative consequences to increase the likelihood of a behavior, such as reducing conditioning drills for athletes who consistently attend practice. So, cognitive behavioral approaches. Cognitive behavioral approaches assume that internal events have an important role in behavior change. Two techniques that we consider here as a goal setting and a technique that involves association versus dissociation. So, association This involves focusing attention inwardly on bodily sensations, movement, and performance-related cues. Athletes participating association might concentrate on their breathing, form, or technique during workout or competition. This internal focus can enhance skill, execution, and awareness, leading to improved performance. So, while dissociation is contrast, dissociation involves directing attention away from the performance-related cues and towards external factors unrelated to the activity. This can include focusing on distractions like music, scenery, or counting repetitions. Dissociation can help athletes manage fatigue, reduce anxiety, and maintain motivation during long or challenging workouts. Okay. Goal setting. Goal setting can be a useful motivational technique for improving exercise behavior and adherence. Association and dissociation, people focus on their attention during exercising, are also important to adherence to the exercise program. When the focus is on internal body feedback, it is called association. When the focus is on the external environment, it is called dissociation. So both association and dissociation have their place in sports and physical activity, and the effectiveness of each technique can vary depending on individual preferences, goals, and the specific demands of the activity. So decision making. Decision making, whether to start an exercise program, can often be a difficult decision. To help people in this decision making process, physiologists develop a technique known as a decision balance sheet. So a decision balance sheet is a tool used in decision-making processes visually to the pros and cons of a choice, or the advantage or the disadvantage. So by systematically evaluating the potential benefits and drawbacks of different options, individuals or teams can make more informed and balanced decisions. This approach helps to clarify priorities, identify potential risks, and ultimately choose the option that aligns best with their goals and values. So next is the social support approaches. So in our context, social support refers to an individual's favorable attitude towards someone else's involvement in an exercise program. Social and family interactions may influence physical activity in many ways. So social support approaches are essential for promoting well-being, resilience, and personal growth, as they enhance individuals' ability to cope with challenges, achieve goals, and maintain healthy relationships. There are 3 social support approaches. First is the emotional support, informational support, and the companionship support. Intrinsic approaches. Most of the approaches discussed so far rely on some sort of gimmick, knowledge, feedback, or reward system to enhance exercise behavior. Although these cues and rewards can certainly help improve exercise adherence, we all know that the most lasting motivation comes from within. Okay, last page is the treatment of childhood and adolescence obesity. So there are 7-step model: the medical management, education, environmental changes, support groups, cognitive behavioral therapy, short-term and long-term immersion, and bariatric surgery. So, the 7-step model for treating childhood and adolescence obesity is a comprehensive approach aimed at addressing the multi-phase nature of obesity in young individuals. So overall, the 7-step model provides a framework for addressing childhood and adolescence obesity comprehensively, emphasizing early intervention, lifestyle change, family involvement, multidisciplinary care, and long-term support to promote healthier outcomes. So that's the end of our report. Thank you and God bless.